Welcome everybody to our very first Facebook Live chat. We're so excited to have you here. My name is Andrea Baer, and I am the Community and Program Development Specialist for Arrhythmia Alliance. Arrhythmia Alliance is a coalition of charities, patients, and patient groups, caregivers, medical groups, and allied professionals. We provide support, education, and awareness and information for all of those affected or involved in the care of cardiac arrhythmias. We're here today because it's World Heart Rhythm Week, and World Heart Rhythm Week is an annual event that Arrhythmia Alliance has been hosting since 2010, and it's designed to raise awareness of heart rhythm disorders across the globe. So SVT Awareness Day is a part of that week, and that's what brings us here today. Yesterday was officially SVT Awareness Day, but we had to spread the love out a little bit because we had so many exciting things happening. So today I'm joined by Dr. James Ip as a full professor and the director of cardiac pacing and implantable devices at Weill Cornell. Dr. Ip has performed thousands of procedures, including catheter ablations of arrhythmias, implantations of cardiac devices such as pacemakers, defibrillators, and biventricular devices for cardiac resynchronization therapy. He is one of the leading implanters of subcutaneous implantable cardioverter defibrillators, or SICD, as well as leadless cardiac pacemakers. So welcome, Dr. Ip.
Thank you, Andrea. It's a pleasure to be here.
Great. So let's get started. Just as a note to all of our audience members on Facebook, please comment with any questions you might have during the chat because we can answer them at the end. We see you and we will be answering those questions as we get them. As a note, please don't ask any questions with any personal identifying information because we are on a public platform. And please realize that Dr. Ip is not able to give you personal medical advice because he's not your treating physician. So now that we've got that out of the way, let's get started. Why don't you start by explaining what SVT is?
Sure, yeah, I'm happy to. SVT, or supraventricular tachycardia, is a sudden fast heartbeat that arises from the top part of the heart, or the top chambers of the heart. It can take the form of most common type, which is AV nodal reentrant tachycardia, a sudden arrhythmia spinning around the middle part of the heart, or the AV node, which is where the impulse travels from the top right part of the heart through the middle part of the heart and the bottom. So that middle part is called the AV node. So there is a mechanism where an extra beat enters that circuit and suddenly the heart can beat very quickly. A second type is called AV, or atrioventricular reentrant tachycardia, where people are born with extra wires between the atrium and the ventricles. And these extra pathways can form circuits between the top and bottom parts of the heart and enter through the middle part of the heart, create another loop. And then the last, least common one is called atrial tachycardia, where there's a focus either in the top right or the top left of the heart that beats very quickly. And so all of these types of arrhythmias can beat very quickly. The heart rate can speed up all of a sudden for no apparent reason, and patients can feel their palpitations, and then it can suddenly go away.
Interesting. So what kind of symptoms would somebody with SVT have, or what would it be experiencing when they have these episodes?
Yeah, most people, when they have SVT, they will feel their heart pounding much faster. They may take their pulse. They may have a general sense of anxiety, maybe associated with some chest discomfort or lightheadedness because the heart is beating so quickly, blood is not flowing efficiently through the body. They may feel a little lightheaded. Rarely it gets to the point where patients develop or feel like they need to faint. They actually faint, pass out because the blood is not circulating well. But it's mostly the very sudden and quick heartbeat that they feel. Some people, surprisingly, don't not have any symptoms, and they actually are just diagnosed because they notice that their heart rate is suddenly much faster. In fact, this happened for my father. I bought him a Christmas present one year was a Fitbit watch, and suddenly noticed that as soon as I put it on, his heart rate was about 130 beats a minute, and he wasn't aware of it. And so he was eventually diagnosed through that device with SVT.
Wow. So why is it important to see a doctor if you, let's say you feel these episodes of fast heart rate? Why is it important to see a doctor?
Well, certainly if someone has any discomfort, chest discomfort is a warning sign that something, the SVT can cause a stress on the heart. And that's a sign that they should go immediately to the emergency room or call 911 because there are medicines, if the episode does not stop on its own, patients need to be given a medication to suddenly stop it. And certainly if patients have symptoms associated with the SVT, that needs to be treated so they no longer have symptoms. And there are some patients, as I mentioned, that don't have much symptoms, but if their heart rate is much faster for a long period of time, that stress on the heart can lead to weakening of the heart or stress on the heart. So these episodes need to be addressed and prevented.
Right. So what kind of treatments are available for someone with SVT?
Oh, the treatment of SVT ranges from the most conservative approach, which some patients, when they have some of these circuits, especially the ones that involve the middle part of the heart, they can do what's called a Valsalva maneuver, where they just bear down like you're making a bowel movement, or these vagal type maneuvers like splashing cold water on the face or coughing, or they can send a pulse to the middle part of the heart, slow down conduction temporarily, and abort one of these episodes. If that works for a patient, then that is a way to manage SVT, especially if episodes are infrequent. They can try to stop it on their own. If that doesn't work, certainly they have to seek medical attention to have it taken care of. And then other treatments for SVT include medicines. Some patients are prescribed medications to take that can affect the conduction of the through that middle part of the heart that I mentioned. Some of these medicines can also try to suppress some of these foci. A lot of them are sort of trial and error. Sometimes they work, sometimes they don't. Sometimes they can be associated with side effects. Some people, they tolerate it quite well. So that's sort of the middle way to treat these types of arrhythmias. And then a more definitive treatment, especially for patients who have frequent episodes and leads to complications, we can do something called catheter ablation, which is a curative procedure, minimally invasive, where we place wires into the heart and identify where the circuit is, do a treatment to essentially stop the circuit or interrupt the circuit and prevent these SVTs from occurring again.
Fabulous. So can someone with SVT live a long and healthy life, or is this something that is very detrimental to their life?
Most people can, as long as there is no consequence to having frequent and long-lasting episodes. Patients, generally will have normal life expectancy. I mean, there are other types of arrhythmias in that category of SVT, and there's a condition called atrial fibrillation, which is probably more common than the SVTs that I've described, but it is a fast heartbeat from the top of the heart. That's sort of a different topic of discussion. But most people with specific SVT or that I described have normal lives.
Fabulous. So my last question for you is, why is World Heart Rhythm Week so important?
Oh, I think I think it's great what you're doing, your organization is doing, and just bringing this just awareness of arrhythmias to the public. I think not many people know that these arrhythmias exist, and sometimes patients can have symptoms that are ignored, or maybe they're told that, oh, it's just a panic attack, or you're just having, stress or anxiety, but they truly have arrhythmias, pathology in their heart that needs to be addressed and brought to a physician's attention. Then patients can have a treatment for it, and then, as we mentioned, just live long and healthy lives after successful treatment.
Yeah. So as I go through a couple of things that we have to offer, I just want to make sure that everybody out in the Facebook world knows that you can put your questions into the comments of this live, and we will see them, and we can answer your questions if you have any. World Heart Rhythm Week is really important here for us not only because it's, what we do as a charity, but because so many people can get the help and the support and the resources that they need if they just knew that what they're experiencing is something that so many other people experience. I know that, some of the great words are, I know how you feel, because you know that you're not alone. And that's so vital to a successful recovery in any type of condition, but especially with heart rhythm, because it's not something people can see. So, it's not a broken arm or anything like that. And so if you can find other people who have experienced the same types of things, it just brings a lot of peace and comfort to know that you can do it. So I have some questions that we're going to show. The first one is from Jessica, and it says, should I avoid caffeine altogether, or can it be consumed in moderation?
Yeah, that's a good question. We know that caffeine in general is a stimulant. Some patients, if they have arrhythmias, some of them can be sensitive to caffeine, can trigger, but every patient is different. I mean, with any of these arrhythmias, some patients know that there can be triggers, like, for instance, atrial fibrillation. We've done studies. We know that alcohol can certainly trigger some of these things. But if specifically if the question is related to SVT specifically, we know there is an anatomical circuit or electrical circuit that all you need is just an extra beat at just the right time to enter in that circuit, and then you're off to the races. So some of those things are even if certain behaviors are avoided, it's sort of chance that these things happen, and avoiding or completely avoiding certain things may not prevent SVT from happening.
Great, thank you. So the next question is from Leonardo. He says that he read about a nasal spray that's being tested on patients suffering from tachycardia. Is it also being tested in Europe?
Yeah, and this is a great question. The nasal spray you may be referring to is something called etripamil. Etripamil is a calcium channel blocker that has been developed for patients with SVT to be delivered as a nasal spray. It's rapidly absorbed through the nasal mucosa, enters the bloodstream, and can act at that part that I mentioned, that baby node, slow it down conduction and abort some of these circuits. It's actually been a very promising drug that's been used in many clinical trials throughout the world, US, Canada, Latin America, Europe. And these are, this is a promising new treatment. I happen to be involved in a lot of these studies, and I've seen it work. It's pending regulatory approval, so it's not available yet, only through a clinical trial. Most of the trials have been completed and are in follow-up.
Great. All right, the next question is from Sam, and she asks, would a catheter ablation help?
Yeah, absolutely. As I mentioned, the sort of the spectrum of treatment, from just conservative treatment, doing those Valsalva maneuvers, taking medications on a daily basis, and then the more definitive one is catheter ablation, which is which is essentially can be curative in certain forms of SVT, and recurrence rates are low. Risks are also low. Whenever we're putting in wires to the heart, there's always risks of injury to the vessel or injuries to the heart, but those complications are rare. And so yes, definitely catheter ablation can help.
Great. And then as a follow-up, Annette has asked, why do so many people require repeat ablations?
Yeah, so I would say often patients can be treated with a single ablation and have over 90% cure rate. Whether they have, if patients require repeat ablations, it's possible that maybe the tissue grew back, or maybe they developed another type of arrhythmia besides the initial one that was treated. So the recurrences rates are quite low, probably less than 10% of ablation for SVT. Now, AFib ablation is another category for another discussion, but ablations are not necessarily curative in that sense, in that particular category of arrhythmias, but patients can do well.
Okay. And then I have a question from Judson. He says, since you mentioned devices for patients use, as your father had successfully used to identify his arrhythmia, which particular device, like Apple 9, Fitbit Versa, do you recommend for SVT patients?
Yeah, that's a good question, Justin. I would say that I don't necessarily endorse a particular product, but I think it's important to understand the limitations of some of these devices. And so, yes, the Fitbit, Apple Watch, Garmin devices, some of these devices are based on the light sensor on the back of the wrist, which in most cases are pretty accurate when the arrhythmia is regular, nice and regular, like SVT. Sometimes when people have irregular rhythms, like atrial fibrillation with variable pulsations, then the heart rate may not be as accurate. And then what I recommend is if patients truly want more accurate assessment of heart rate and rhythm, is to get a device that can do an ECG recording. So there is something called a Cardia device, another product that's not worn on the wrist, but you take out this little plate, you can do a single lead EKG with your fingers. Apple Watch has that feature where you can put your finger on the bezel. Fitbit also has that feature. You put your fingers on the Fitbit, but these things are just trying to generate a single lead from the right hand and left hand that doctors use to diagnose these arrhythmias. Of course, having 12 leads on the chest simultaneously would be ideal. That's why we do that in the hospital, in the clinic. But for patients to do it themselves, especially if it's infrequent, having a nice recording, a nice steady recording. So practice if you ever use this. Practice my advice to patients, practice when you're in normal rhythm, so that when it's game time, you know how to get a good recording. And so once you get that, you can share that with your doctor.
Well, and that's fun. I never knew what the green light on the back of my Garmin was. So now I know. I always what's that for?
Yeah.
So, okay. So the next question comes from Tracy. And earlier she had asked how she could manage symptoms, but I feel like you might have covered most of that. But if you have other things to add, that'd be great. But now she's wondering, when does she need to seek medical attention?
Yeah, I would say when, especially if during the episode of SVT, if it doesn't stop with just sort of simple maneuvers, as I mentioned, coughing, blowing through a straw, just increasing that intra-abdominal pressure, the cold water in the face, then it's time to seek medical attention, especially if the diagnosis is not clear. Chest discomfort, that's a red flag. So immediately go to the hospital or call 911. If someone has already had the diagnosis of SVT, then they sort of know what's going on. And we do know that some of these episodes do stop sometimes with those maneuvers. Sometimes they stop on their own. Sometimes they don't. And as I mentioned before, we don't want it carrying on for a long time, especially days or hours, days. And you do want to get medical attention sooner to stop the arrhythmia. And that's why when we talked about sort of treatments, I mean, the only good way to stop an episode right away is to get a drug immediately through the vein if those conservative measures don't work. That's not everywhere, of course, and that's the whole point of the development of this nasal spray, which has some promise, because if you take a pill, it takes a while between when you swallow the pill, gets absorbed in the stomach and goes in the bloodstream and then goes to the heart. So there is a delay there, and it doesn't always work. And we've these small studies that have tried to look at this show that there's not necessarily there could be some risk in untreated SVT when you take a pill that's uncontrolled. So the nice thing about that spray, if it does get approved, is that it can be absorbed quickly, can act on the heart quickly, and then it actually goes away from the body quickly. And so it's quick onset, quick offset, and it's actually studied in patients who are not in the hospital, actually doing it on their own. It's been quite effective, stopping on average 17 minutes after the nasal spray is delivered.
Great. Great. So I guess that was perfectly segued into the next question from Leonardo again. He wanted to know how much time, I mean, we all know drugs take a really long time into development. And will it ever be available in pharmacy? And I'm assuming that means as a prescription. And you know, ideally or roughly, how much time does it take to get a drug to market?
Yeah. I mean, it does take a while. It takes a lot of effort. Goes through several clinical trials, and which, in the case of etripamil, has already been done. If you want to read more about it, there are these node studies, node 1, node 301, node 302, node 303, and then even this rapid study that was published in the Lancet last year. All of them have shown good safety and efficacy of this drug. Now we're taking that data and presenting it to the FDA, and the FDA is going to do their due diligence to evaluate before approval. But we're hoping that it'll be available, you know, as early as next year or the year after. It's sort of a process of that is a bit of a mystery to me, but I think that it does have some promise, and hopefully will be in pharmacies to help patients with SVT.
Yeah, that's fabulous. That's great. So I don't see any other questions yet on Facebook, but while we're waiting to see for another moment or two if anybody jumps on with any other questions, I want everyone to know that we do have resources available on our website. We have an SVT patient guide. We have a lot of, probably every type of heart arrhythmia you could think of. We have information for patients on our website. And you can go to heartrhythmalliance.org and you can download resources. You can read, you can connect with us. We have coffee mornings, as we like to laugh because we probably shouldn't be drinking coffee with heart arrhythms, right? But you don't have to drink coffee to come join us. You can just bring your water, and that would be great. We hosted one yesterday. Well, we hosted a few yesterday, and they're fabulous. People love to hear from other patients and share with each other their journeys, and that's so important. So you can visit us for more resources online. Find us on all of the social medias, Facebook, Instagram, X, formerly known as Twitter. And we would love to hear from you. If you have any questions, you can also reach out to us as well. And so I do have a question that just came in. Jenny wants to know if SVT can be hereditary. Her mother was diagnosed with it.
Yeah, typically not. There is SVT can be associated with certain hereditary conditions, but that's probably the least common types of SVT. Typically, this is an arrhythmia that just develops. Some people, as I mentioned, are born with these extra wires, and it's not necessarily passed on to the next generation. It's more of a developmental issue in the heart, and the insulation essentially between the top and bottom. There's a break in the insulation. That's where these extra wires essentially are forming. And then the more common type, the AV node reentrant tachycardia, that's involving the tissue in the middle part of the heart, and that tissue can change with age and time. And so there are many patients who develop SVTs later on in life, in their 50s, 40s, 50s, 60s. And so actually the oldest person I had done an ablation for was over 100. And so she didn't have any arrhythmias until much later in life. And so I think it's always important with these SVTs to get the diagnosis, to figure it out. And they can happen pretty much any time. Younger patients may suggest that extra wire. Older patients, maybe that AV node reentrant tachycardia. But yeah, it runs the gamut.
Great. So I think as a follow-up question before we end our live, You had spoke earlier about AFib, and is it a part of the SVT family of conditions, or what's the difference really?
Yeah, I mean, SVT in general is a more encompassing term. It's anything supra. So supra is above the ventricles. So anything above the ventricles can be where, and the tachycardia is just a fast heart rate over 100 beats a minute. So the more common types of arrhythmias within the atrium or the AV node, the most common is atrial fibrillation. So atrial fibrillation is a form of SVT, but mostly when people are talking about SVT, they're speaking about that AV nodal dependent SVT, or within the AV node reentry, or involving that extra wire or that spot. But yes, AFib is a more irregular form. So it's conduction occurs in an irregular fashion from the atrium to the ventricles. And these SVTs, or these paroxysmal, so sometimes people add that P letter, so paroxysmal supraventricular tachycardias are more regular, even-spaced fast heartbeats.
So is there a difference, and I'm not even going to try to say the words, between PSVT or SVT?
Not necessarily, yeah. No, the P is just being more specific. Paroxysmal just means that it starts and stops sort of erratically.
Will someone end up having to have like a pacemaker or an ICD or anything like that with an SVT? I know you talked a lot about treatments, but I wasn't sure if a pacemaker or ICD is something that is considered.
Yeah, no, an SVT. So a pacemaker are these devices that we implant for patients who have a slow heartbeat. And so they don't prevent a fast heartbeat. So people can, even if they have a pacemaker that prevents the slow heartbeat, they can develop an SVT later on. It would be unusual for patients with SVT to need a pacemaker unless they have an additional disease within their conduction system that's separate from these fast heartbeats. As far as the treatments go, I mentioned the ablation procedure, which often involves ablating these extra wires or these short circuits in the middle part of the heart. It's rare, but it's a known risk of 1 in 200 people during the treatment of the middle part of the heart can abolish conduction between the top and bottom parts of the heart, and then they need a pacemaker afterwards. And then defibrillators are devices to treat fast heartbeats from the bottom of the heart, but those arrhythmias are called VT, so no S. They're ventricular tachycardias, fast heartbeats from the bottom of the heart, not involving the top of the heart.
Great. And now are there, I know that there are several types of ablations now. Are they all suitable for SVT or only certain ones, or can you explain those?
Sure, yeah. In terms of the several types of ablations, maybe they're talking about referring to certain technologies. So there are different technologies that we use to ablate tissue in the heart, from the most common one being radiofrequency or burning energy. There's something called cryo-energy or freezing energy. And then the new kid on the block essentially is something called pulse field ablation, which involves electroporation of the tissue. And so most commonly, at least in the adult population, we use radiofrequency or burning energy during the treatment. But sometimes, as I mentioned, the treatment within the AV node, we want to preserve normal conduction while abolishing the pathology, so the extra circuit. Sometimes that we may start off with burning energy, and it looks like we're encroaching on the let's say the normal conduction system. Then we may switch to freezing energy, which is potentially more safe and reversible. So that's when we change. Haven't used pulse field ablation specifically for SVT. It's mostly used for atrial fibrillation ablation.
Great. Well, thank you so much for joining us today. We really appreciate your time. It's been very informative, and hopefully everybody out in the Facebook world has enjoyed it as well. I just wanted to remind everyone, you can join us online on all of our social channels, and you can also find us at heartrhythmalliance.org. for any resources. And happy World Heart Rhythm Week, Dr. Ip.
Okay, same to you. Thanks, Andrea. It's a pleasure.
Thank you. Bye.